Hey everyone and welcome. Today we're going to jump into a super important topic, viral STIs. Our goal here is to just break it all down. What they are, how they're managed, and maybe most importantly, how we can talk about all this with clarity and support instead of fear.
So, here's the big question we're really diving into. That word, lifelong. I know, it can sound pretty heavy, but the word I want you to focus on is manageable. Because as we're about to see, modern medicine has completely changed the game here.
So what's the deal with a viral STI? Well, unlike a bacterial one that you can often knock out with antibiotics, a viral STI is caused by a virus that kind of sticks around in your system. But, and this is a huge but, they can be managed so effectively with treatment that people can live totally long, healthy lives.
Okay, to really get a handle on this, we're going to zoom in on 4 of the most common viral STIs. Knowing a little about each one really helps take the mystery out of them and shows all the different ways they can be managed.
First up, we've got HIV, which stands for Human Immunodeficiency Virus. And just like the name says, if it's not treated, it's a virus that can weaken the body's immune system over time, making it tougher to fight off other bugs.
Now, in the very early stages, some people might feel like they have the flu, tired, maybe a fever. But here's the thing, and it's really, really important. A lot of people have no symptoms at all, especially at first. This is exactly why regular testing is the only way to be 100% sure about your status.
Next, let's talk about genital herpes. It's caused by the herpes simplex virus, or HSV. You might have heard of HSV-1, which usually causes cold sores, and HSV-2, which is more often linked to genital herpes. But it's good to know that either type can cause outbreaks down there.
Everyone's experience with herpes can be really different. It's often known for causing outbreaks of blisters or sores, but then people can go for really long stretches with no symptoms whatsoever. And for anyone who gets outbreaks a lot, there are antiviral meds that can make them happen less often and be way less severe.
All right, moving on to HPV, or human papillomavirus. This one is actually the most common viral STI out there. There are over 100 different kinds. In fact, most sexually active people will get some type of HPV during their lives. A big reason HPV is so widespread is that a lot of the time, there are literally 0 symptoms. Your body's immune system usually just clears it on its own, no problem. Some types, though, can cause genital warts, and more seriously, other high-risk types can, over a long time, increase the risk for certain cancers. That's why preventative tools like screening and the HPV vaccine are such game changers.
And the last of the big 4 we're covering is hepatitis B. This is a virus that specifically attacks the liver. It can lead to a short-term illness, or it can become a chronic, long-term infection. Because hepatitis B is all about the liver, the symptoms are, you guessed it, tied directly to liver health. We're talking things like stomach pain, dark urine, and jaundice. That's when your skin and eyes turn a bit yellow. It's all a sign that the liver's inflamed. But the good news? There's a super effective vaccine to prevent it.
Okay, so we've identified the infections. Now let's get to the most hopeful and empowering part of this whole story, how incredible modern medicine is at helping people manage these viruses and live a great life.
This right here, this is a total game changer. It's called antiretroviral therapy, or ART. It's a daily medication that works so well, it can lower the amount of HIV in the blood to a level that's so low, it's called undetectable. And get this, an undetectable viral load means a person stays healthy, and importantly, they can't sexually transmit the virus to a partner.
When it comes to preventing HIV, we've got 2 amazing tools in our corner, PrEP and PEP. Think of it like this. PrEP, or pre-exposure prophylaxis, is something you take before any potential exposure to prevent getting HIV. It's like a shield. PEP, on the other hand, is post-exposure prophylaxis. That's your emergency plan, a medicine you take after you think you might have been exposed. Let's just pause on this number for a second. 99%. When you take PrEP as prescribed, it's 99% effective at stopping the sexual transmission of HIV. That's just a remarkable level of protection. It's one of the most powerful tools we have. With PEP, the clock is ticking. Seriously. If you think you've been exposed to HIV, you have to talk to a doctor or go to an urgent care clinic right away. To work, you have to start the 28-day medication course within 72 hours, 3 days of the exposure. It's like an emergency stop button for transmission, and it really works.
So let's zoom out a bit and look at the full prevention toolkit that's out there for everyone. These are all strategies that can seriously cut down the risk of getting or passing on any STI.
Your prevention toolkit has a bunch of great options. You've got barrier methods like condoms. There are powerful vaccines for things like HPV and hepatitis B. And then there's the super important habit of getting tested regularly so you always know your status. And of course, abstinence is always an option too. The key thing is you have choices, really effective choices to protect your health.
Now, just as important as all the medical facts is the human side of all this. You know, stigma and shame can be these huge walls that stop people from getting tested or getting the care they need. So let's talk about how we can tear down those walls and build up support instead.
This quote just hits the nail on the head, doesn't it? Getting an STI is a part of human health. It's not a reflection of someone's character or who they are as a person. Just having that non-judgmental attitude is the biggest first step we can all take.
So, if a friend or a partner opens up to you about their status, what's the best way to be there for them? First off, respect their privacy. It's their story, not yours to tell. You can gently encourage them to get care if they need it, but honestly, the most powerful thing you can do? Just listen. Listen with kindness and empathy. That alone can make all the difference in the world.
And that brings us right back to our main message. Yes, these viruses are lifelong, but that's not the headline. The real story, the one that matters, is that with the treatments and prevention tools we have today, a diagnosis is not a barrier to living a long, healthy, totally vibrant, and fulfilling life.
So, I want to leave you with this question to chew on. The science is incredible, and the medicine is amazing, but the final piece of this puzzle is communication. Thinking about how we can all work to make these conversations easier, more normal, that's how we move forward together and build a healthier, more supportive world for absolutely everyone.